here to support a very honest, a very accessible, a very affordable, a very humane universal health care for all Americans. That's what we're here for. Just like you, I've made up my mind. We are at a singular, important point in the history of this country. A decision on health care reform that is going to shape what we look like, how we treat ourselves, and the quality of life for the American people. And that decision is upon us. I have, and I continue to support a single-payer system of health care like Medicare for all Americans. And it is not a contradiction, my friends, to say that I support a public insurance plan for the American people that must be part of this health care reform package. The opposition includes the Chamber of Commerce. The opposition includes, to some extent, AMA. The opposition includes the big corporate pharmaceuticals that have been running health care for so many years here. The opposition is private insurance carriers, of which 2 carriers in this state cover 63% of the people of Arizona. We have some opposition from the Hospital Association. And you're going to hear scare tactics as we get closer to this debate about government interference, socialism. And cost. 30% of what you pay is for administrative overhead. 50 million uninsured, 50 million underinsured, 61 million predicted by the year 2020 in this country if something doesn't change. We've relegated those people to emergency room health care, nothing else. And if nothing changes by the year 2020, 20+% of our income will be dedicated to health care in this country. We see the rising premiums that you can't do anything about. You're locked in, 30%. Workers' unions have to then fight to try to maintain a level of health care coverage while wages and working conditions have to be put aside while you take care of the most pressing issue, which is health care. And then we have the human costs, which Josefina talked about. Those choices are being made daily in this country. Do I get my medicine or do I pay the electricity? Do I get my medicine or do I bring food home? Those choices are unacceptable, unnecessary, and very, very much un-American in this country. The bankruptcies, the leading cause of bankruptcy, not only in the state but across the country, is the high cost of health care and families having to divest themselves in order to be able to qualify and get some of the public assistance that their families are going to need. Being turned down and moved around for pre-existing conditions where you can never quite get the coverage that that person needs if your insurance company changes. Small businesses that cannot afford to take care of their employees because they cannot afford to extend to them the benefit of health care coverage. The health disparities in this country. Those that have and those that don't. And that becomes pandemic in terms of people that have no health care and their situation becomes worse and worse. And there's really no preventive care in this country, no wellness program, no ability to take care of people before they're sick. But there is a huge level of support among the American people to do something to do it right and to have a huge public role. A public insurance plan that is not triggered, that doesn't say, well, let the private insurance companies have at it for 5 years. If they fail to take care of people, then we'll allow you to have a public plan. No. And we must have, for a public insurance plan, the Medicare provider network so we get off to the kind of start we need to have for the American people. This public insurance plan has to be competitive. I find it so ironic I find it so ironic. The free market rules. All we are saying with a public insurance plan, let us compete. Let us offer the patient, the consumer, a choice. Given that choice, that consumer, that patient makes their decision. What is wrong with the very fundamental premise of this nation? Let the market dictate. And what is private insurance afraid of? Not to allow an even playing field, competitive situation for a public insurance plan like Medicare. What is wrong? We need physician-driven quality care decisions that need to be part of a public option. We need no denial for pre-existing conditions at any level. We need a cap on premiums, and we need a competitive, no non-subsidized private insurance situation so we're both on the same even playing field. Not like Part D, but an even playing field. Let me just end right with a couple of things. I, as one member of Congress, will not support a health care reform package that is compromised and without a strong public insurance plan like Medicare. I cannot support it. I will not support it. And let me end with this. We have a role to play here, all of you and all of us. Healthcare reform is personal, daily, around the table, affecting family members, affecting neighbors, affecting children, affecting our senior citizens. That is a consummate issue that is part of our everyday life. What you need to do is to demand of Congress courage, and to demand of Congress that the public good must be the primary driver of health care reform. If we do that, if we put your interest ahead of all other special interests, if we put them there, we will have a huge step toward public insurance like Medicare for all Americans and begin finally to address the issue of health care not being a privilege but being the right of the American people. Thank you very much. Thank you.